Hello, everyone. This is Dr. Williams, acupuncture physician. Sometimes people call me Dr. Singh. That's an attachment to my name. It's my mother and father's name. So if you ever hear Dr. Singh, I'm the same person. Well, we are going to go over some fantastic herbs. And we're going to make this as easy as possible. What I like to do is recap a little bit from the previous video. So if you're coming to this channel for the first time, welcome to the Easy Medical Learning. And this topic is on TCM herbs. Thank you for joining us, and I hope you consider coming back to seeing us again. If you care to do that and you'd like to ensure that you get the videos come up automatically, you may click the subscribe and ring the bell. And if you think the video is pretty good, you could also press the thumbs up. It does a lot, actually. It helps to circulate the videos in a profound way. But the most important part of this is for you to leave a comment regarding what you're hearing and what's being said and any of your concerns, because you're preparing for the board exam. And the board exam is a pretty easy exam. Positive thinking creates positive action. All right. We're going through the wind, cold syndromes. So that would mean that we're going through the warm, acrid, pungent herbs. Most of those herbs, they do go through the lung and the bladder, but you're going to find some changes, very significant changes soon. A wind-cold syndrome typically is an aversion to cold and no sweating, but we know that that's not true because Gwazi, you do have sweating. So again, there's minor exceptions, and I'll point them out to you so you could figure it out pretty easily. Another thing I'd like to mention is all of these herbs, it will release the exterior, hence the name exterior releasing herbs. However, they will not all induce sweating. And you'll find out that that condition would be when you have a wind heat syndrome mixed up into a particular herb. The exception to that rule is the previous herbs that we went through, which is Qiang Jia, that handles both wind cold and wind heat syndrome. And these are the chief important things to observe, is those particular exceptions. I'm going to go through it and we're going to look at it on a slide, so this way you could take a look at the wording in case if you're not understanding me. And again, you don't need to actually say the herb when you're taking the test. You have to be able to identify it. So going through this video, I may just simply spell the name of the herb. Again, in this particular category, it is not often you'll see anything where it treats wind heat. But again, the herb I just told you, Jingjiie, it handles both conditions. So pay close attention to that. We will go through the indications, but the focus is to take this one step at a time in preparation for a test. So the main key is to go through the herbs, find out the functions, identifying what the differences are. Another thing I want to say is when you see expel, EXPEL, you'll find typically that there'll be dampness in that particular condition. So, summarizing, some of the herbs will not induce sweating because there's a wind heat and there's also wind dampness. So, in that instance, you're not going to see that. They all do not go through the lung. It is often that they do, and most profoundly that they do, but we're going to find what the exceptions are, put it in a category, and then the light bulb will go off in your head. So that's basically it. Before we get to the slides, here are the common contraindications for exterior releasing herbs. Yin deficiency, spontaneous sweating, night sweating, chronic, that means a long-standing boils and carbuncles. So if you're finding out that some of these herbs treat that, that would mean that it's for a short period of time. Lynn syndrome, blood loss. And the caution is also you got to stop taking them when you get the effect. And it should not be decocked for a long period of time. Again, the pharmaceutical actions for exterior releasing herbs is reducing fever, alleviating pain, relieving inflammation. It's a diaphoresis, which comes into sweating, antibacterial and antiviral. The term yin deficiency, yang deficiency, yin excess, yang excess. I'm not going to go through that in this video because it's a bit too much. I will cover that in a specific video, so therefore we could put it into plain terms so it's clear and very easy to grasp what it means. All right, guys, I'm just going to tell you about these herbs and then I'll move into the slides. Fang Fang. It is a warm. This herb is used for treating, it's used to release the exterior. And it does also, in addition to that, it expels wind. This herb, it is pungent, it is sweet, and it's slightly warm. This is for the bladder, the liver, and the spleen. You notice this does not say anything about a lung. So in your mind, you should have some idea that maybe this herb would not induce any sweating. So Fang Fang is pungent, sweet, and slightly warm. And it is a root, in fact. Fang Fang, what does Fang Fang do? It releases the exterior. It expels wind. Remember when I told you when you hear the word expels, dampness is typically would be in these type of functions. Release the exterior, expels wind dampness, and alleviates pain, expels inner wind, and relieves spasms. The type of indications would be for all, and I'm saying it loudly, all kinds of wind cold syndromes. That would be a very good test question, so pay attention. Fang Fang, all kinds of wind cold syndromes. Now, it is less dry than the other wind expelling herbs. And remember I told you, whenever you see expelling, There's some dampness in there. And it's for all kinds of wind patterns. It could be for hot or cold. It could be for upper or lower or exterior or interior. So Fang Fang covers a lot in terms of exterior releasing herbs. Also, Fang Fang is for bee syndromes, especially when the wind predominates. And that would make sense because I just said all the different aspects of wind pattern. It's for trembling and tetania, TETANY, and that's due to wind toxicity invasion. So something has entered this person's system either through the nose, through the mouth, any opening. It also goes to the liver and to the spleen. So it's going to the liver and spleen channel in addition to the bladder. You could use this also for liver qi stagnation, overacting spleen, and you know overacting spleen would mean like abdominal pain, and that would follow by diarrhea and another diarrhea, and then pain reduced. You remember when I said earlier that the flavor and the property of Fang Fang, it's pungent, and most of them aren't going to be pungent / acrid. But I said it's also sweet. Sweet is another indication to let you know that it's angelic, that it has something to do with being sedative. These are the little things that I'm going to point out so this way you can get a grasp of it and start looking at it for yourself. Just by knowing these small little factors regarding whatever herb it is that you have on the test. The dosage for Fang Fang is like most of them in general. This is 3 to 10 grams, and they should be decoct in water for oral dosage. The contraindication or the caution is deficiency of yin and blood. That's two things, deficiency of yin, and like I said earlier, most of them deals with deficiency of yin. So that's something that you need to register in your head, that that's what it certainly covers. Qiang, I'm going to spell that. QIANGHUO. This is the next herb that I'm going to talk about. It is pungent. Like I said, most of them are. But it's unlike Fang Fang, this one is bitter. It's aromatic. And it is also warm. The most important thing about this herb is this has a disperse effect. And it's for the Qiang headache. The question might be asked, which herb would take care of a Qiang headache? And this would be the herb for you to select. Qinghua. All right, it goes through the bladder and kidney. It does not induce sweat at all. It does not induce sweat. Very important. So it's going through the bladder and it's going through the kidney. You notice it doesn't say anything about lung. It releases exterior and disperse. This one is dispersing cold for wind cold syndromes. This is particularly concerned about headaches, body ache, and that's due to wind cold with dampness. Now here goes with dampness. It says that it expels wind dampness and it alleviates pain. And whenever you hear pain, you're going to automatically think B syndromes. Most profoundly, it's for the upper limb and the back. And that would take care of the Qiang and the Du channel, because that's the area, which is the nape of the neck, of course. Of course you know that. So those are the areas that it actually operates on. The caution for this is if you overdose, you may cause vomiting. And also, it is suggested it protects the liver. Here we go. On the screen, easy medical learning herbs. The topic is exterior releasing herbs. The ones that we're going over now are the warm, acrid, pungent herbs. Take a look at the herbs that we've done so far. Look at the screen. Mawa, Guizi, Zisu, Zisu-I, Zisu-Ging. You need to look at the previous videos because I have more details regarding that. Fang Fang is what we're going to do today versus Xinghua. Qiang Hua. Again, remember when you're taking the test, nobody's asking you to say it. They're just asking you to identify it. That is the reason why I'm taking a lot of time by showing these things to you on a screen so you could be prepared to look at it in a written form. These are the rest of the herbs that have not gone through. Take a look, please. I have not done these as yet, but that will be coming up very, very soon. All right, today's topic, exterior releasing warm herbs, are typically warm, pungent, acrid herbs. Very often go through the lung and the bladder channel. There are some exceptions. Big word, some exceptions. And we're going to identify those exceptions. They're mainly exterior releasing. You sometimes will not see induced sweating. And it's these herbs, the exterior releasing warm, acrid herbs, they're typically for, or they are for wind cold, wind heat, wind dampness, and summer heat, which means that this wind identifies that these are things that's happening very sudden, very abrupt, and is lodged in the exterior. Today's Fang Fang, I already went through it. Take a look on the screen. Exterior releasing her herb, bladder, liver, and spleen. This herb is pungent, warm, and sweet. Sweet just as Guizi is. I'm just reminding you, we're going to start categorizing. Fang Fang also, in addition to being exterior releasing, it does expel. Whenever you see the word expel, take a look at the word expel. That typically you will see something pertaining to dampness. So it expels all kinds of wind cold syndromes. It expels wind dampness, alleviates pain. Whenever you see pain, usually you see B syndrome with that. Fang Fang also expels interior wind and relieve spasms, trembling, and tetia because of toxicity invasion. I'm going to give you the definition for tetia, but for now, let's look at this. Fang Fang, it goes to the liver and the spleen channel. Now, so it can be used for liver qi stagnation, meaning overreaction of the spleen, abdominal pain followed by diarrhea and repeated diarrhea, and pain is reduced. Fang Fang, it's all types of wind patterns. Hot, cold, upper, lower, exterior, and interior. That's what Fang Fang does. Now, the caution for Fang Fang is like most of the herbs in this particular category. There's a contraindication for deficiency. Typically, it'll be yin deficiency, and it is also blood deficiency for Fang Fang. That's the contraindication, and that is the caution. Fang Fang, it's a root, it's pungent, it's sweet, it's slightly warm. Bladder, liver, spleen. When you see sweet for the flavor, it's usually going to be associated with being angelic. And it does not, I'm repeating, it does not induce sweating. This particular herb, Fang Fang, is less dry than other expelling herbs. And I already said of all the functions, please take a look at the screen. Take a look and read. The Fang Fang is bee syndrome when wind predominates. And again, this is an unusual attribute of Fang Fang. Now, earlier I said that this also trembling with tetania caused by toxicity. So now let's look at the word tetania and find out the definition for that. Let's take a look. That simply means intermittent muscular spasms. That is the definition. It was already stated about the spasms. Now we're going to go to Qinghua. Qinghua or Changhua is an exterior releasing, warm, pungent, bitter. So this is the opposite in terms of the flavor. This is bitter and Fang Fang is sweet. It is aromatic, and this particular herb goes through the bladder and the kidney channel. You should know by now that what that means. You don't see lung. It does not induce sweating. Very important. You're going to be getting this. The bell is going to go off in your head so soon. Qinghua is exterior releasing, warm, pungent, bitter, and aromatic. Now, it is root for the bladder and the kidney channel, and it's most popular for the treatment of wind cold syndromes. This is very important. Qinghua is specifically for headache, body ache, because of wind cold with dampness. Now, remember I said anytime that you see dampness, consider that you're going to see expel soon. So now, in the prescription for this particular herb, which you'll find is, as stated earlier, this herb, it is good for Qiang headaches and Qiang and dew channel. That would be the nape of the neck. To their areas where it associated or served by the Qiang and dew channel. As you know, the dew channel is in the center, in the back. Let's take a little pause for a second and look at the definition. Qiang. What is Qiang headache? It's at the nape of the neck, dealing with the dew channel. Let's look at another definition. Expel. When you see expel pertaining to a herb, earlier I said expel, look forward to seeing dampness in that particular herb, that it helps with dampness. Remember, we're taking a little break. Whenever you see the word dispel, as in what you saw with Jingji, dispel, it would dispel. We're talking about Jingji now. Whenever you see dispel, that is going to be typically something where it has something to release the exterior, but in what way? Mostly for surface, such as the skin, like in rashes and itches and so forth. We're continuing now with Qinghua, exterior releasing herb, warm, acrid, and pungent. This herb, it does release the exterior and disperse. This is very new. Disperse cold. Others you've seen expel, you've seen dispel. This herb, it disperses cold. It's used for the wind-cold syndromes, and it, as you know, the syndromes are typical of headache, body ache, and is called by wind-cold dampness. Remember when we talked about it earlier about when you see expel, you would see the word dampness? It just also expels wind dampness. It alleviates pain. B syndrome, mainly the upper limb, the back, and this herb, as I said earlier, it disperses when cold. The contraindication for Qinghua is a deficiency syndrome. That would be the contraindication. Another contraindication is exterior condition that has dryness of the throat. Another contraindication or caution for Qinghua, that's Qianghuo, overdosage may cause vomiting. Come back and join us again here at the Easy Medical Learning. The topic in the series that we're going through are herbs that are acrid or pungent, warm, the warm category, that are exterior releasing.